So we have Gabby. She's gonna be recording the video on that one. Got my supplies here. The mannequin. Yeah. You can put away.
Yep.
So I'm gonna go ahead and begin.
Supplies. Okay.
So now, close the door, provide privacy. Hello, my name is Ruby and I'm going to be your nurse today. I noticed in the chart that your doctor ordered a nasogastric tube and an indwelling catheter. I'm going to be also getting a specimen from the indwelling catheter. So as I go, I'll be explaining the procedure and letting you know what I'll be doing, okay? But first, I'm going to provide hand hygiene. I'm going to get your full name and date of birth, please. Betty Bettingson of March 3rd, 1967. Okay, perfect. I'm going to go ahead and raise the bed to my height. I'm going to raise the head of the bed to about 30 to 45 degree angle. Do you have any allergies, Betty? No? Have you had any surgeries or any traumas to your nose, nostril area? Nostril area, excuse me. So I'm gonna go ahead and open my supplies. I'm gonna throw this away. I'm gonna place a towel over my patient. I'm gonna put some lubricant I'm gonna check the patency of the nares. Okay, and I'm gonna go ahead and apply it on the left side, Betty. Now, I'm gonna tell you a little bit about this procedure. So a nasogastric tube is to prevent blockage and to suction out any toxins you may have in your stomach. I'm gonna be lubricating the tip of this tube and inserting it through one nostril. It's gonna go down your throat and into your stomach. If throughout the process you feel uncomfortable or can't handle the pain, just raise your hand and I will stop the procedure, okay? Okay, so first I'm gonna go ahead and measure from the tip of the ear to the nose, then from the ear to the sigmoid process, and it's about 52, 53. I'm gonna go ahead and lubricate the tip. One thing I'm forgetting before I begin that, I need to provide hand hygiene and put on some gloves. I would have put gloves on before I lubricated it. Now I'm lubricating it and I'm gonna go ahead and insert it through one nostril. If you could please breathe in and relax. And I'm gonna remove this pillow and have you lean your head back. I'm gonna give you this cup of water and if you can please take sips of water while I'm inserting it. So 1, 2, 3. So once I feel resistance, I'm gonna have you lean your head forward, bring your chin to your chest, continue to sip some water, and then as I slowly insert the tube. If the patient cannot, I should stop the procedure if the patient becomes uncomfortable or can't handle the discomfort. I'm gonna go ahead and leave this here. I'm gonna put some tape temporarily on the nose. Okay. Just so it doesn't move. I would also mark the place where the tube is at for future nurses to assess the tube and make sure it has not moved. I'm gonna go ahead and attach the tube to the gown. so it doesn't move. Are you doing okay, Betty? Once I'm finished with that, I'm gonna go ahead and order an x-ray, but we can also aspirate some liquid from the tube, but the results are more accurate if we receive x-ray results. I'm gonna go ahead and remove my gloves, perform hand hygiene. I'm gonna put on clean gloves to perform oral care. So I would just have her spit out and get her all cleaned up. I would have put on barrier cream just to protect her nose. Once we receive the results of the x-ray, then this is when I would place a permanent fixture to the nose so it doesn't move. I would have made sure that it was marked just for our future nurses to make sure that the tube doesn't move. So I'm gonna go ahead and dispose of this. I'm gonna perform hand hygiene. Okay, Betty, I'm gonna go ahead and put this pillow behind you. I'm gonna go ahead and lower my bed. I'm gonna lower you so I can go ahead and do my next procedure that your doctor has ordered for an indwelling catheter. An indwelling catheter is gonna help you go to the bathroom, and once I insert it, I'm gonna gather a specimen from it, okay? I'm gonna raise the bed to my height. Okay, Betty, doing okay? So I'm gonna go ahead and uncover you, okay, Betty? I would have placed a bath towel over her. Now, a urinary catheter, I'm gonna insert it through your urethra up into your bladder to help you go to the bathroom. If at any time you feel uncomfortable, please let me know and I can stop throughout the procedure. I'm gonna go ahead and uncover you if that's okay. I'm gonna perform hand hygiene, put on clean gloves, I'm gonna go ahead and uncover you. And then I'm gonna have a separate kit to perform pericare. I'm gonna go ahead and open the labia. I'm gonna clean from up to back, in the middle, up to back, in the side, front to back, and as well from the sides to make sure we keep it clean because this is a sterile procedure. So now I'm gonna go ahead and get rid of these gloves, throw them away, perform hand hygiene. I'm gonna go ahead and place you. I'm gonna flex your knees. I'm gonna fix the position of this bed. Okay, have you supine. We're gonna open. Getting rid of the trash. We're gonna maintain sterile field. Fix my other hand once I have these on. And like I mentioned, Betty, if anytime you feel uncomfortable, please let me know and I will stop the procedure. So we're gonna put this pad underneath you, put the shiny part down, making sure to remain clean. I'm gonna put this white cover over your skin, the area just to protect your skin. I'm gonna prepare my supplies. I'm gonna open the swab sticks. I'm gonna put some jelly out. Throw this away, maintaining a sterile field. We're gonna put this. So now I'm gonna move over to the bed. I'm gonna go ahead and open the labia with my non-dominant hand. I'm gonna clean the inside from the front to the back with the swab sticks. Throw them away in the middle, front to back. Throw them away on the side, front to back. And then I'm gonna throw this away. This, I would not have had it here. Okay, Betty, you're gonna feel a little bit of pressure, and I'm gonna have you bear down as I place this catheter in. So I would have already looped it up. Okay, if you could please bear down, I'm gonna slowly insert it. Once I see urine, I'm gonna go ahead and insert it 1 to 2 inches more, hold it, and then I'm gonna insert the liquid into to fill the balloon. And this is what is gonna hold it in place, okay, Betty? So I'm gonna dispose of this. I would make sure I meet resistance. Perfect. I'm gonna go ahead and remove this. Just so this doesn't move, I'm gonna, with clean gloves, making sure my gloves are not soiled, I'm gonna place this around your leg to hold it in place. I'm gonna put this on the side of the bed. Once that's done, I'm gonna go ahead and not remove my gloves yet because I want to rip this off. Okay, we're gonna get rid of this. I'm gonna remove my gloves, perform hand hygiene. I'm gonna put on clean gloves. And once again, I would perform peri-care if needed. I would get the patient all cleaned up, make sure there's no of the lubricant that I applied. I would get her cleaned up, clean the sides from front to back as well, and then I would get her in a comfortable position. I would remove this, and when I come back, I would place a new waterproof pad underneath, get you in a comfortable position. I would dispose of gloves, perform hand hygiene, and get you all covered up. And while I'm here, I'm gonna go ahead and clamp the tubing just so I can wait 15 to 30 minutes and be back to collect a specimen that your doctor has ordered. Are you doing okay, Betty? Any pain? No? Okay. I'm gonna go ahead and bring you down. I'm gonna throw this trash away. I would document the procedure for the indwelling catheter and the gastric tube. Get my patient in the correct position so it's disposed of everything. So now that it's been a while, I'm gonna go ahead and the doctor has ordered for the gastric tube to be removed. I'm gonna go ahead and go on this side of the bed. I'm gonna bring my supplies, the emesis basin, towel. I'm gonna grab a towel just so I can bring the bed up. my height. Wait just a little bit more. Okay, I'm gonna bring it about 45-degree angle. I'm gonna place this towel over you. I'm gonna perform hand hygiene. I'm gonna go ahead and put clean gloves on. Okay, we're gonna make sure the suction is disconnected. We're gonna make sure the patient has a towel. I'm gonna go ahead and unclip this from the gown. I'm gonna remove the tape. And I'm just gonna have you take a deep breath, hold it, and I'm gonna go slowly pull the tube out, okay, Betty? Please let me know if you feel discomfort. Okay, slowly pull it out. Okay, are you doing okay, Betty? I would note that the tip is intact. Make sure of the discharge. If any, I would dispose of this in the correct place. I would throw away my gloves, perform hand hygiene, and put on clean gloves. I'm gonna provide my patient with an MSS basin and some towels just to get her cleaned up and perform oral care once again. And so once she's all cleaned up, I'm gonna go ahead and dispose of this in the correct area. I'm gonna note the output of the suction tube, of the suction container. I'm gonna document it. I'm gonna go ahead and lower you, Betty. Are you doing okay? Okay. I'm gonna go ahead and collect that specimen since it's been about 30 minutes since I clamped the tubing. Once I collect the specimen, we're gonna go ahead and remove it because your doctor has ordered it for it to be removed. Okay. So, I'm gonna bring the bed up to my height. I'm gonna perform hand hygiene, put on clean gloves. I would have labeled the container with the patient's name, date of birth, the date it was collected, and the time, and so it can be ready once I collect the specimen. So I'm gonna go ahead and uncover your leg, Betty, okay? So I'm gonna go ahead and disinfect the tubing, the port, I mean, for 15 seconds. I'm gonna grab the syringe and collect about 10 mils of urine. I would have opened the lid already. Be careful not to contaminate the inside. I would be careful not to splash any urine out. I would dispose of the syringe, cover it back up. I would have already labeled it. I would have unclamped the tubing, covered the patient back up. Okay, Betty, we're just getting ready, about to be finished, so then I would dispose of gloves, perform hand hygiene. I would, since the doctor has ordered for me to remove this, I'm gonna go ahead and grab some supplies I forgot on this side of the bed. so we can go ahead and remove it. I'm gonna grab a waterproof pad. Raise the bed up. Place the patient in the proper position. Since she is a female, she's gonna be in the dorsal recumbent. Okay, Betty, I'm gonna go ahead and uncover you, Betty, okay? If you feel uncomfortable at any time, please let me know. I would have placed a bath towel to cover her. So I would have performed hand hygiene, put on some clean gloves. I'm gonna make sure the bag is emptied and placed into the proper measuring container so I can measure the output and document it in her medical record. I'm gonna go ahead and disconnect the tube from her leg. I'm gonna grab a clean syringe, to go ahead. I'm gonna assess I'm gonna assess the area for any irritation or any drainage, make sure everything is okay. I'm gonna go ahead and insert this. I'm gonna grab it at the tip, take out all the fluid, all the liquid. And then I'm gonna go ahead and make sure everything's out, and then I'm gonna go ahead and pull it. And then I would have placed a waterproof pad, which I forgot to put, but I would have placed that at the beginning. And then I'm gonna go ahead and dispose of this in the correct area. I'm gonna get the patient, I would have, since I have lubricants and soiled gloves, I would grab some clean gloves and my last step would be to perform pericare, get her all cleaned up, make sure she's in a comfortable position, lower her knees. Get her all cleaned up and then dispose of these gloves, perform hand hygiene, dispose of everything per facility policy. Make sure the patient is in a comfortable position, the bed is lowered. Okay, Betty, we are finished with today's procedure. I'm gonna go ahead and just document and place your call light within reach. And if you have any questions or any concerns, please press your call light, okay? Okay, so then I would perform hand hygiene, I would document, and then I would clean up and leave the room.